Well, good afternoon, everyone. Welcome to the hottest ticket in town today at 3 p.m. And we're actually probably living up to Councilmember Jawando's statement about the millions watching at home for a change. But I'd like to welcome you to a joint education and culture, as well as health and human services meeting to discuss Montgomery County Public Schools' return to in-person learning. We are joined today by Dr. Jack Smith, the superintendent of Montgomery County Public Schools. We also have Mr. Derek Turner, Chief Engagement, Innovations, and Operations. Mr. Seth Adams, the Director of Department of Facilities Management. From our Department of Health and Human Services, we have our County Health Officer, Dr. Travis Gales, as well as from our Office of Emergency Management and Homeland Security, Dr. Earl Stoddard. I think at some point we may be joined by Dr. McKnight, I'm not sure, but certainly wanted to thank all of you for being here in attendance. I know that we have many of our colleagues who are not on the joint committee and want to welcome them as well, as I know that many people are very concerned about what the status is of our return to in-person learning. Many folks have heard from parents as well as from stakeholders as to what exactly is the plan. I know that MCPS has been pushing out information. I get it on my phone all the time via text messages. So thank you very much, Dr. Smith and team, for that. But certainly wanted to go into greater detail. I know that when we actually first shut down our schools and then started having meetings about potential reopening, we said we would come back and do this. And so I really appreciate everyone taking the time out to make sure that folks understand the amount of work that goes into creating a plan like this. It is incredibly difficult because balancing the safety of all of our folks that will be in our school buildings, along with prioritizing the learning education that we know that happens better in our school buildings than on computers, is certainly something that is incredibly important and incredibly difficult. And so I want to thank all of the partners, all of the stakeholders who have put forth the effort to make this happen. I really want to thank Dr. Gales and Dr. Stoddard, as I know I've heard from numerous entities, including MCPS, about the work that you've done in helping to guide folks to create a great pathway to re-entering back into school buildings, as well as other types of businesses throughout the county. And as the chair of the Education and Culture Committee, having a true passion for education, as all of my colleagues do, I get it. I understand why parents are concerned about making sure that their children have an opportunity to return back to the classroom. I also get it, and as a parent, and understand that many parents are concerned about the health and well-being of their children and their families. And I also get it that our staff are concerned about making sure that they can return and interact with their students in a positive way, but are also concerned about the health of themselves and their families as well. There are a lot of balancing interests that go into creating a proposal like this. And so I'll say it again, it is not easy, but I know that if anybody can do it, we here in Montgomery County can do it and get it right. And so with that, I want to turn to my co-chair, the chair of the Health and Human Services Committee, Councilmember Gabrielle Albornoz.
Thank you, Councilmember Rice. And point of privilege, Dr. Smith, the first time I've had the chance to see you publicly since your announcement. It has been an honor serving with you, sir. You have served this district well. I wish you much luck in your future endeavors. You've left quite a legacy here, and just want to thank you for that legacy and that work. So as Chairman Rice said, we're all coming at this issue from different angles, from different perspectives, different family circumstances and situations. All of us have received thousands of constituent correspondences and questions regarding the school reopening with suggestions and ideas. And I do, as the chairman said, have a supreme amount of confidence in the administration and leadership of Montgomery County Public Schools, and know that they have been doing everything they can since the beginning of the pandemic to provide as much support for our children and youth and their families as they can. And their primary goal is to ensure the safety and security of students, faculty, and staff. And I had the opportunity to listen in to the Board of Education discussion recently regarding reopening and know how methodical and thoughtful and the amount of effort that has been put into the plan that will be discussed this afternoon. I also know that the important intersection between the county's public health team, led by Dr. Gales, Dr. Kroll, and Dr. Stoddard, is intricately linked. The decisions we have made as a body, as the Board of Public Health, draw a straight line between the ability to open our schools and maintain them being open in the future. This really will take all of us, not just the administration and the teachers and staff. It will take every resident of Montgomery County continuing to adhere to the guidelines and the standards and following the science so that we can do everything that we can to protect our students and to get them back in the classroom. I'll end with a personal note so that we can get to the presentations. My wife is a teacher at an independent school. And back in October, her school decided to go back to a hybrid learning environment. It was an incredibly emotional time in our family. We debated whether or not my wife should return to work at all. We were concerned at that time about her going back because of our families and not wanting to put them at risk. It was a very difficult and emotional time, and it took a while for us as a family to get acclimated. And so I understand the reservation and the hesitation and the concern felt by many right now. And I also know that all of us want to do everything that we can to get our kids in the classroom, but to do it safely. So I look forward to this discussion. I'm sure there will be questions, but I look around this screen and just feel tremendously hopeful that collaboratively between our school leadership and our public health team, that it puts us in the best possible position to move forward. With that, I yield back to you, Mr. Chairman, and look forward to the presentations.
Well, thank you very much, Mr. Co-Chair. And I did want to acknowledge that I see that we're also joined by Dr. Janet Wilson, who's our Chief of Teaching, Learning, and Schools. So thank you very much, Dr. Wilson, for being here. And then Ms. Helen Nixon, also, I see you as well, the Associate Superintendent of Human Resources and Development. So thank you very much for joining us. Let me turn to Ms. Rodriguez-Hernandez. And Ms. Rodriguez-Hernandez, I take matters of personal pride in Ms. Rodriguez-Hernandez. She actually worked for my office before going to central office staff, and the amazing packet is certainly attributed to my, no, I'm just kidding. It's attributed to the great work of Ms. Rodriguez-Hernandez, and really want to thank you for laying out all of the important information and salient points. So, ma'am, I am going to turn it over to you to walk us through the goals of this joint committee, and then over to Dr. Smith.
Hi, yes, thank you all for joining us today for the presentation to the council. I know that you are going through a lot right now with the reopening of schools, and we really appreciate your participation. The chairs of the committee have 4 goals for today's meeting. First, it's to receive the update from Montgomery County Public Schools on their reopening plans and understanding the key data and information used by the Board of Ed as part of their decision making. The second is to review and discuss how community spread and state and county public health orders have impacted the school reopening process. The third is discussing future considerations and support for new issues related to implementing the hybrid instruction model. And fourth is discussing how the council can support the Board of Education and MCPS in their continued efforts to safely reopen schools. The packet for today's work session includes summaries of the information provided to the Board of Education over the past few months, but specifically February 9th and February 23rd, and also includes today's presentation to the Joint Committee. Thank you.
Well, thank you very much, Ms. Rodriguez-Hernandez. So, Dr. Smith, I know that on February 9th is when the board voted to establish a resolution for return to in-person learning, and so we're all anxious to hear some greater details. So I'll turn it over to you, sir.
Thank you, Chairman Rice, and good afternoon to all the members of the County Council and all of the staff members. I remember just, it seems like a few days ago, we were all meeting in person all the time, and this has been a particularly difficult time for us to do this together and meet and share information, and so it's really good to see all of you today. You know, last March 13th, at the close of of school. We sent all of our 165,000 students home, expecting that they would be back in 2 weeks after an emergency closure, because that's what the state declared. And I'm not criticizing Dr. Salmon or the governor at this point, because that's what they knew at that time. Who could imagine that almost a year later we'd be here continuing to think and work together on how to go through what has become a very thick fog over these months of trying to figure out in a totally unknown world. So many things look the same, but yet it's all different, every single thing. And that extends to the school system. Everything we do is now done differently than it was prior to last March 13th. And so we have greatly appreciated the joint planning with the Department of Health and Human Services and the county government. There's been good collaboration and good communication and work there. And we look forward to that going forward. Certainly the MCPS internal recovery team has consulted regularly with Dr. Gales and Dr. Stoddard. They have been tremendously positive, productive, and helpful partners in this with us every step of the way. Dr. Gales and I spend almost every Friday morning together early with the state Deputy Secretary of Health, Dr. Chan, and her team, and the state superintendent, getting updates from the state and trying to sort through the many mixed messages that come out from the federal and state level. And that has been a challenge, but Dr. Gales and Dr. Stoddard have been really great advisors and experts and partners in this effort. We certainly have many, many factors that we have to think about all the time. We have to think about the protocols that we have to deal with. You know, some people write to me as recently as today and say, I demand that you put all students back in school right now, 5 days a week. And I understand that frustration. What I don't understand is the idea that we have 6 feet physical distancing requirements. Those are the requirements. And so literally dividing up the square feet in a school, in a classroom, in a hallway, in a cafeteria, it's not possible. So as we think about those physical distancing and classroom configurations, those have been very challenging. The CDC regulations for mitigating risk, as I just said, the 6 foot physical distancing, the wearing of face coverings and masks, the sanitizing, the contact tracing if there is an outbreak, all of those things have to be built in and considered. We also have to think about the ongoing meal distribution. Montgomery County Public Schools has provided more than 10 million meals at this point into this pandemic for students across the summer, school holidays. We make provisions over weekends. When there are snowstorms, as we had a few weeks ago, we provided provision on Wednesday for Thursday and Friday in anticipation of the weather, as well as continue to support the weekend and working in partnership with all of those folks. We also have to think about how to distribute materials and supplies. We have the pressure of student activities and athletics and the desire for those. And recently the governor informed us that he would be shipping point of contact test kits to schools so that we could test students with symptoms or adults with symptoms or inside that closed environment of a school once we reintroduce students, as well as the potential for pool testing or surveillance testing and how that we might go about doing that. These are all areas of real concern and real effort, and they are certainly things that we will be discussing during this meeting. During the summer of 2020, Dr. Gales and Dr. Stoddard worked with us to configure classrooms, and they were part of groups of stakeholders that toured College Garden Elementary and other models of how we'd set up. We recently created videos of the models of how schools look, and this week the media visited one of our middle school and took pictures of all of the work that's been done. We've also done the behind the scene work, and Seth Adams is here to talk about the efforts around HVAC and air exchange and ventilation and air filters and portable air filters, all of those things that have to be built into that. As I've said, the partnership around COVID-19 testing has been incredibly important as we've had many, many staff members on the front-facing part of the school system in the community, providing technology, connectivity devices, providing materials, providing meals, and setting everything up that we just described, and the support from the county health department around when we do have a case that is identified to contact trace, and to do all of that work to make sure that we are being as careful as we can possibly be with our staff members who have been doing this work since last March, the end of last March, started doing this work that we're discussing. We've also have 2 high schools that are now serving as vaccination centers, and we anticipate that there may be more of that in the future as vaccinations become more and more available, and working with our partners at the county government to do that. Certainly the school system has pushed hard to have employees of school systems that will interact with children and that will be front-facing in this whole effort to be vaccinated, and the county has agreed to that. The problem has been a relatively small supply of vaccines that has been a challenge. All the while, we are planning for a massive summer program. We hope that it will be in person. We don't know what the rules will be exactly by the time we get to that, but we're planning for it so that we can provide services to children across the summer, and we're planning for next school year in addition. And we have issues such as graduation and end of the year senior events that are very important to folks. We know last year it was very, very frustrating and disappointing to people. I know, Mr. Rice, I understand personally, and many others, that it just was so frustrating. So we have come fully into gear on that to think about how we can do that and provide the best possible experience given the rules that we're living under at that time. Dr. Pollard, the president of Montgomery College, and Dr. McKnight, who Dr. McKnight's not able to join us today, but who are the co-chairs of the committee at the county and in the education mission recovery team. They've been doing that work together and been very collaborative and working together. So I could go on and on with all of the other aspects of this, but it's better for you to have a chance to hear from my colleagues here content, and then to be able to ask questions, offer comments, suggestions, and have a discussion about these things. So I will now turn it back to you, Mr. Rice, or do you want the next speaker just to go forward? Okay. All right.
Yep, you go at the next speaker.
Okay.
So I think that's Dr. Wilson, but if we can pull up the slide deck,
yes,
we can go through. Thank you.
Thank you, Derek. I was having trouble finding my mute button. So.
So today we're going to review the safe return to in-person learning for Montgomery County Public Schools. And thank you very much for having us here today to review our plan. This plan certainly has been a culmination of months and months of work in what I know you know to be very shifting conditions along the way as we've been on this journey together. Next slide, please. I believe this slide will be covered by Dr. Nixon.
Good afternoon, everyone. A quick update on our vaccination work. So to date, we have been able to have 5,851 Montgomery County staff employees vaccinated through our partnership with Johns Hopkins University Medicine. We meet biweekly with our colleagues at HHS, who are constantly in contact with us, letting us know how things are going and when we can hope to start on a rollout for MCPS staff. We know that they continue to be vaccinating our county residents who are 75 years of age and older. At our last meeting, Dr. Gales gave us some tips to reach out to some other possible agencies, and we have done just that. And we continue to look for other opportunities to partner. And just coming into this meeting, I received an email from a DHHS colleague to touch base on some potential opportunities in the next couple of weeks. So it's an ongoing partnership and relationship, and we keep one another in constant contact, and we look forward to our continued work. Thank you, Dr. Wilson.
Yes. So let's talk a little bit about the first two really major steps towards bringing students back into building. And a frequent question that I get is, well, how many students are coming back? And in the fall, as many of you know, we did a survey of our parents. It was a parent preference survey, and we asked, how many of you would be willing to return your children to school when it is in fact time to do so? And that survey closed in December, early December. And the latest numbers indicate to us that there's approximately 64,600 students who want to phase into our buildings between the start of March 1 and through the spring, as we bring our students in a variety of phases, which I'll cover for you in a few minutes. That leaves 95,800 or so students who are residing still in the virtual space for their school. So as you can imagine, we've started school with all students tied to teachers in a virtual classroom. We've developed classroom communities, which are now in effect splitting because with the CDC guidelines, when we move students into buildings, we have to be very careful about the numbers of students in each class. So a class of 26 students actually may be moving into 3 different locations. One location will be students are remaining virtual, and then the remainder of the students who are in building for that period of time may be in 2 different locations due to the guidelines. So let's look at March 1. Here we'll be concentrating mostly on some specific special education students and also some specific career and technical programs. Next slide, please. All in all, it's about 750 students who will be returning to us in these programs, both the CTE and the special education programs. And you can see on the screen, we are focusing on some of our most vulnerable students, the K-12 autism program, our extensions program, our school community-based programs, and our special schools will be opening up. We are keeping the schedule consistent to Monday, Tuesday, Thursday, and Friday, with Wednesday being that support day for students, office hours for teachers to offer additional supports to their students. And then again, that's a virtual learning day. This is critically important because as we'll talk later about safety mitigation, if we were to have to pivot some students back onto virtual space due to an outbreak or whatever, the schedules will parallel. Next slide, please. So for our career technical programs, and we have many, and we're proud to say that over the last number of years, our enrollments in these programs have increased, but we're focusing on our automotive, our construction, our cosmetology, our healthcare professions, and our restaurant management. These are, of course, the programs that have certificates. They have, students have to take tests. They need to accrue hours in order for them to be able to exit high school and be able to move into these fields with the proper credentials, whether it's immediately into the field or on into a community college or a 4-year articulation arrangement, particularly in the healthcare professions area. So you can see that we will be serving these students at Thomas Edison High School, Seneca Valley, Gaithersburg, Damascus, and Paint Branch. And I won't go into the specifics about the schedule, but we will be bringing those students in, some of which will be seeing additional teachers on site in their high schools, some which will be also tied back to the virtual classrooms if their teachers are teaching a particular class and they still remain on the virtual platform. Next slide, please. So when we get to March 15th, we begin to phase in the rest of that 64,000 students have indicated to us that they would like to return. We're starting with our K-3 students in all of our schools. Most of the schools for the K-3 arrangement will have every day, Monday, Tuesday, Thursday, Friday, every week, because of the literacy and numeracy foundational skills that we know that we really want to make sure that these students have in place for the next year of sequence. We're also bringing in our MET students, our CREA students, our CTE programs, additional CTE programs that did not come in March 1, and additional special education programs. If you'll notice, this is a four quadrant. We have 4 groups of students. Group 1.1 starts on March 15. 1.2, we hope to bring in no later than April 6th. That will be grades 6 and 12. We are monitoring very closely now our grade 12 students, making sure that they are on track to graduate. Our schools are reaching out to them, providing specific services to them, ensuring that they are, now that the second semester has closed, again, on track to graduate. We'll also be doing grades 4 and 5 in group 1.2, and again, additional special education programs and additional CTE programs. So by the end of the first 1.1 and 1.2, all of our special education programs and all of our CTE programs will be back, all of our elementary, and then we will begin with the phase-in on middle school and high school. So group 2, we will begin group 2.1 no later than April 19th. We will focus on grades 8, 9, and 11 of those students who have indicated they want to come back, and last but not least is grade 7 and 10. Now, we have, like you, received many emails about wanting to accelerate this particular phase-in. And one of the things that we know that we need to do in particular is make sure that we have planned and accounted for absolutely everything. And we know that when we bring in group 1.1, it will be over 20,000 students. Some of our students in our kindergarten have never been in a school before. They will not know the routines. Other students who have been in schools before in those very young grades will come back to a very different school. And I think it's very important that we understand that school for the remainder of the year will not look like it did prior to March 13 of last year. And again, we go back to, we have 95,000 students still remaining virtual. We want to rotate in schools. We want to provide a value-added experience. We want to provide a combination of a variety of instructional approaches to support our students. We will be evaluating how we do with group 1.1 and making further determinations about whether or not it is feasible to move more students in a quicker fashion. Next slide, please. At this point in time, I'll turn this over to my colleague, Mr. Turner.
Thank you, Dr. Wilson. So I just want to briefly go over the foundation for the safety of our students and staff as we return to in-person instruction. What's not listed here, first and foremost, is the health condition of the county. And thanks to the guidance of the county council, the county executive, and of course, my 2 favorite colleagues, Dr. Gales and Dr. Stoddard, the COVID case rate in our county has plummeted. And I think that's because of the great guidance that's been provided and the enforcement and just the great work to be committed to the safety. So with that, we have an R metrics around 12 cases per 100,000 for 14 days, which is below the threshold that the board set when they talked about reopening schools. And that's such a positive piece of news, along with test positivity being at 3%. So we're really happy to have those. And then that's when we can really implement all of these mitigating steps, because that these add additional layers of safety. So the things that are mandatory and not in question: face coverings and PPE. Every student, every staff member will be required to wear a face covering while they're in school buildings and while they're on buses. This is about the safety of everyone, not just the person who's wearing the mask, but others around them. There will be exceptions for those students who can't wear masks for health reasons or disabilities, and we recognize that, and we've made precautions for our staff who are supporting those students. So that's already being considered. Physical distancing is going to be critical, one of the key factors. We're building our schools to be 6 feet, every student to be 6 feet apart from the other student to make sure that we are safe when possible. As you can see, if you'll see in the videos, desks are spread apart, which means the kids are further apart, but it also means that not as many kids can fit in a classroom. So our classrooms are going to look a lot different, a lot more sparse than usual, but that's for safety purposes. Hand washing. We have hand sanitizer stationed throughout every building. You can't go more than 5 or 6 steps in a building without hand sanitizer. Plenty of opportunities for hand washing. Regular cleaning. We're going to be providing regular cleaning in our buildings, on our buses, deep cleaning when needed, because we're committed to making sure all surfaces are addressed. There's going to be those wipes in the classrooms. All those important tools are available in the building and ready to be deployed for the safety of our students. And contact tracing, which we'll talk about a little bit later. But again, that's one of those key prongs. If there is a positive case, how do we move forward to make sure that everyone is safe? And those are the 5 pillars that are defined by the CDC for reopening schools. And we have met all those 5 pillars. And I think that's important for our community to know, that we have met all of those 5 pillars. But we didn't find that to be acceptable. We wanted to go above and beyond what the CDC was asking. And that's why we're working with Johns Hopkins around vaccinations, as my colleague, Dr. Nixon, referenced. We're working with health attestations, which is a weekly reminder to parents that you have a commitment to your students' health and to the health of those around you. So just filling out a form. I don't have a fever, and we're going to give out thermometers for those students. Every student's going to have a thermometer. I haven't been around someone who's had COVID-19. I haven't been in someone with close contact. All those important factors, we're going to ask them every week. And if they say they have, then they're not allowed to come in the school building, and we'll pivot them back into a virtual experience. Ventilation and water systems, I'll come back to, but we've done a lot of work there, spent millions of dollars to make sure that our HVAC system is strong, and how we've addressed our water systems. And most importantly, additional school health staff. The Department of Health and Human Services is critical for MCPS. As you know, and our community might know, our school nurses and health techs are employees of Health and Human Services. They're not MCPS employees. And again, I thank the Department of Health and Human Services so much for supporting us in this effort as we transition back to in-person. But we know they have a lot on their plate, and we don't expect them to drop everything and be in our buildings full time while those vaccinations are going on and testing. So we're also going to be using contractual health staff to help support where there are gaps, so that there's additional health support in schools. And we'll also talk about COVID-19 testing. We know that the Rockefeller Foundation and the CDC have said one of the best steps for safety is to add a screening or surveillance protocol where kids and staff are tested regularly. So if we can go to the next slide. I just want to take a moment to talk about contact tracing. I know that a lot of our families are anxious about what happens if there is a positive case in a school building. And I want them to know we have a plan. And it starts with the teacher identifying a student, or a student identifying themselves if they have symptoms, and then goes to the school health nurse and goes through a really rigorous process to make sure that that student is addressed and quarantined and safe with their family. A test is taken, notification happens to the family. What I can say is that we're not reinventing the wheel here. We know that Dr. Gales and his team have been doing contact tracing through the community and at private schools for quite some time now. So they are skilled at this. This is built on their plan. And I will turn it over to either of them if they want to add in for the moment. Perfect. All right. So again, this is our flow chart, and we have the same thing for employees. If we can go to the next slide, please. One of the things we thought was really important, again, with the Rockefeller Foundation's guidance and the CDC, is to have what we call surveillance testing. And this will be regular weekly testing, voluntary for asymptomatic kids and staff in our class beginning March 15th. The process works, and as many of you have seen, and I know the county has this as well, and for the kids, it's you stick what it looks like a Q-tip in your nose, swirl it around in the lower part of your nose 4 times in one nostril, 4 times in the other nostril, put it in a tube, it's collected and sent to the vendor, and then we know if anyone in that pod or that cohort tests positive for COVID-19. If they have, then we can say we can quarantine that class and then work around the specific PCR testing to determine which student tested positive. And that way we'll know if classrooms are safe relative to asymptomatic students. This is in complement to the what Dr. Smith referenced was the PCR testing being provided by the state to help us support those who are presenting symptoms. We're going to notify our families immediately, as we talked about through contact tracing. If there is a case, we're going to take the precautions, we're going to go through the contact tracing, and we're going to keep our kids safe, and we're going to be able to transition to virtual learning immediately as part of the plan. And this is right now backed by the $5 million worth of spending authority by the Board of Education, who voted on this on Tuesday, and the vendor is ready to go, and we're really excited to have this as a tool for the safety of our staff and students. Next slide, please. And I'll turn it over to my colleague, Ms. Stratman, for discussion of the hubs.
Thank you, Mr. Turner, and good afternoon. Ms. Rodriguez-Hernandez had shared with us some questions that Council had around the equity hubs. So in a week before last, we shared a community message that included the assumption that the child care and equity hubs will end on March 5th with the reopening of schools, and that providers can resume before, aftercare, and Wednesday child care services as of March 15th. But at the same time, we are open to considering extensions to continuing all-day care services through private providers during the transition of other grades and extending all-day care when we have the conditions that a principal is basically able to provide that, interested both in continuing the transitional all-day care, primarily because based on their space availability. Where a principal is able to do that, we are encouraging that, and will do so until all the grades of school are phased in to in-person instruction. As that happens, the school-age childcare providers will continue to follow state and local guidelines for their operation, as Dr. Smith talked about earlier, of course, including protocols around frequent hand washing, use of masks by everyone, and following all the safety protocols. These guidelines continue to call for reduced group sizes, as we've talked about throughout this presentation. We will work with the county health officers and try to determine appropriate group sizes in larger spaces as we move forward with school opening, particularly in areas such as gyms and other places in our school buildings. We had also been asked specifically about parent preference surveys for those parents who have been utilizing hubs and the child care services for their students. Regarding those surveys, we just received this data yesterday, 63% of those students, according to their parents, are expected to return to in-person instruction, with 37% of those students remaining virtual. And then with regard to our 4th and 5th graders, actually we're able to boil that down to 4th through 8th graders. The percentages are exactly the same. 63% of those students returning to in-person, and 37% of those students were planning to stay in virtual learning. So that means, in terms of numbers, that is 105 students. And for those 105 students, our Office of Student and Family Support and Engagement are working alongside school support and improvement staff, HHS providers, HHS supported providers, as well as the school principals, to develop a plan to move forward in working for individual and group student supports for that group of students. In addition, the student family support and engagement staff are reaching out individually to those families to talk to them again about in-person learning. Basically, our staff are circling back. Our goal there is to connect each family, connect with each family, and to have a strategy for working with each student during this in-between time. And some other things you should know, in working with some of the schools, several hub schools are able to extend care to school days, as I mentioned earlier. Silver Spring International, which is a fairly large hub, Strathmore Elementary specifically, to name a few, those schools are able to continue to offer hub services throughout March as we move into transition. So that number is actually lower than the 105 that I shared just a minute earlier. In addition, we are in conversations with Montgomery College leadership. Byron Johns has begun those conversations as well. We hope to try to maybe possibly secure classroom space on some of their campuses. We will know more about that possibility next week. So with that concludes our formal presentation, and we can move, Mr. Rice, to our question and answer and dialogue session.
Well, thank you very much, and a very thorough presentation. I know that no matter how thorough your presentation, you're going to get questions. And so I've got a long list. So let me turn to my co-chair, Councilmember Albornoz, to kick us off.
Thank you. And Dr. Gales, I know you have to leave, but if you could help explain sort of the decision-making tree and what the process looks like internally for purposes of the audience, just better, there's an echo. I'm not sure if it's me. Is that me? I don't know. Sorry. It's better now. Thanks. So Dr. Gales, if first of all, if you could spend a couple of moments talking, as I mentioned at the beginning, of the intersection between the decisions we make from a public health standpoint and how it directly relates to impacting community spread, which is directly related to both the schools being able to open in the first place, but then staying open. And then if you could also talk about the decision-making process internally within HHS as a case is reported within a school, and what happens and how the coordination, what that looks like between the HHS team and the school on whether to close down a classroom, a whole school, how to notify folks. That I know the answer to both, but for the purposes of our public, that would be helpful.
Good afternoon, everyone. Good afternoon to council members and to our colleagues at MCPS. As Dr. Smith mentioned, we very much enjoy working with our colleagues there in general, certainly throughout the pandemic, as you all implement the strategies that you have taken countless hours to put together and put forward. I think the things that have influenced most the recommendations that we have provided from a public health perspective have been guided by guidance from the Centers for Disease Control and Prevention, as well as the initial platform that was put out by the Maryland Department of Education in consultation with the Maryland Department of Health. Experts have been very clear from the early stages of the pandemic when we had these conversations back during the summer, when the first conversations about school reopenings were had. As you can remember, there was a little bit of controversy associated with that, but the factors that went into the guidance were influenced by looking at community transmission. And we were very careful not only to factor in community transmission for our local jurisdiction, but also other jurisdictions, recognizing that students and teachers come from other areas and come into the county to work and then go back to their respective places. The factors that we looked at to measure community transmission were test positivity rates, as well as our case rates per 100,000. And this was consistent. Those were the two leading ones. And other factors we looked at were hospitalization rates and contact tracing rates, those kinds of things. And this is entirely consistent with the algorithm and the platform that was put forward by the Centers for Disease Control last summer to help guide those conversations. And the recommendations that we have continued to provide to MCPS have have not changed or diverted from that. We continue to monitor those trends as it relates to the test positivity and case rate per 100,000 in particular. What has been tweaked is, for example, within those particular boxes, what we would recommend in terms of what's safe to move forward. And though that guidance has been informed by emerging evidence that has been brought forward over the last 6 months since we had those initial conversations about what types of practices would be beneficial to put in place to mitigate transmission. For example, one of the best practices that has been shown to be effective is including some type of testing apparatus. MCPS has introduced a testing apparatus for students and teachers in order to be able to identify cases quicker, to remove them from networks of transmission and keep them from coming back into the classroom. One of the other things that has also changed to influence those measures, which again have stayed the same, is the advent and ability to provide vaccinations to teachers and other staff. Let's be very clear, when thinking about going back to school, recommendations do focus on children, and we are fully aware of the unintended consequences of schools being closed. Also, we have to think about the protection and safety of the students within those spaces, but we also have to think about the safety and protection for other staff and teachers and those kinds of folks. So the ability to be able to offer vaccines to staff has been tremendous, to be able to offer some level of protection as they go back into the classrooms as well. So those factors, again, in terms of the guidance, community transmission levels, are what we talked about months ago and have continued to guide the guidance that we have provided to MCPS in terms of reopening. Now, to pivot to your second question, what happens if you do find a case? And I'll be very honest, we're likely to see cases pop up when schools reopen. We did see that when our non-public schools, some of them did choose to reopen during the fall, and they did experience cases. So what's going to happen is this. Someone tests positive. If it's a student or if it's a staff member within the system, there's a couple ways that the notification happens. One, that employee or that student or that family would notify the school, could notify the school and say, hi, I tested positive. The school would notify the health department. And as part of the traditional disease control process, we would then we would collect more information. We would find out who tested positive, when they tested positive, when they were in the classroom last, who they were around in terms of within that control space. Were there any other types of experiences or opportunities where they may have been exposed to other staff during that time period, to determine who is considered a close contact. Close contact, it depends on the situation, but there's a couple different definitions of that, and I would encourage you to take a look at the CDC website to break that down further. But once it's determined who those other close contacts are, then further guidance would be provided to MCPS and to the individual school and school system to determine how to move forward. So let me be clear, every positive case doesn't mean an entire school's closed down or even an entire classroom. It would depend on the specific situation and the information that the disease control team would find as a result of the contact tracing exercise. And so any of that information, once the investigation is completed, that guidance would be provided. And what could happen is we could get lucky, for example, and someone was out of the classroom over a long weekend and others weren't exposed during the period where we think the person was contagious, and we wouldn't necessarily offer closing down a classroom. But a classroom could be closed, and yes, in worst case scenario, you could have a situation where an entire school is closed due to the extent of that particular outbreak. And that process is consistent with what we have done, we have completed throughout the pandemic, what we have offered in terms of our non-public schools when they have had cases, and that is consistent with what we would recommend for MCPS when they reopen.
Thank you, Dr. Gales. And I think it's important to note that, the confidentiality and identity of the person who tests positive, whether it's a student or a teacher, is held confidential. And so there will be anxiety and questions, I'm sure, from the school community on who is it, have they come into contact folks, but it's important for the public to understand that residents still have, per HIPAA, confidentiality.
That's correct.
Yep. Thank you. I'll defer back to you, Mr. Chairman. We're going to go 5 minutes, but if I could be put back in the queue, I'd appreciate it. Thanks.
Thank you very much. And I neglected to say before I called on my co-chair that we are instituting the 5-minute rule to allow for folks to be able to ask as many questions as possible. What I am going to do, however, is actually make a quick exception because I know that Dr. Gales, you only are with us for another 8 minutes or so. So I am going to kick to my colleagues. I'm going to retain my place, but Councilmember Juando, did you have any specific questions for Dr. Gales?
Yes, I'll just to focus on that since he has to go. Yeah, I have others, but I'll focus on those.
Please, if you could, and then we'll come back to you in the queue.
Awesome. Thank you, everybody. I know you've been working on this for almost a year, Dr. Smith and Dr. Gales and the whole team, so thank you. Dr. Gales, let's start where you left off. Big question. Every parent, myself included, all want to know, as you went into in great detail, what happens when inevitably there are cases and people are infected. You mentioned the close contact in the CDC, and one of the questions that I've received a lot is, we have the science on that. We know, for example, in the indoor dining setting, there are studies showing that, you can have the virus, you can travel 20 feet plus, right, in a room and all those kind of things. So could you just elaborate on how you are going to give guidance about close contact? If a student is in a classroom was suspected to be in a classroom at a time when they are suspected to be contagious, will everyone in that classroom be considered a close contact?
Well, you're not going to like this answer, maybe, but it depends on the situation. It depends on the particular case. And this underscores why all of the measures that our MCPS colleagues put forward, not just face coverings, but cleaning materials, those kinds of things, physical distancing, it underscores why all of those activities are still important and necessary. So it would depend on the type of interaction. Again, were face coverings being worn or hands being washed? The proximity of the types of interactions. So those are the kinds of things that would be looked at to determine, again, what would constitute a close contact. Also, the duration of that type of exposure. So, for example, if you and I are having lunch together in the lunchroom and we don't have on our mask and we're in proximity, that's a different level of exposure than if I'm in the classroom and I'm teaching with a face covering and I have a student who's on the other side of the classroom where we're physically distanced for a time. So it would entirely depend on the situation, but those are the kinds of factors that would be looked into and investigated to determine whether or not someone's a contact.
So you could have a situation where, you did answer my question, you could have a situation where it depends, even if they are in a classroom setting, versus lunch versus how long it was. Okay, so it could depend. Mm-hmm. So people should just understand that it's going to depend on the data you get from the contact tracing. Okay. I have other questions that are probably more related to MCPS, so I will pause because I know so others can ask Dr. Gales questions. Thank you.
Excellent. Thank you very much, Councilmember Juando. Councilmember Navarro, do you have a question for Dr. Gales?
I do not. I have questions for MCPS.
All right. Terrific. Let me turn to Councilmember Glass.
Thank you, Mr. Chair. Dr. Gales, I appreciate you sticking around for a few more minutes. One of the things I learned in this presentation is the number of teachers who have been vaccinated or in line to be vaccinated, 5,851. Which is a very encouraging number. And as was shared, that is through the partnership with Johns Hopkins. And I saw today or yesterday the letter that was sent by Superintendent Dr. Smith and all of the Board of Education members requesting that the remaining teachers get priority within the county system. And so, Dr. Gales, I'm curious if we are going to be changing any of our priority lists here to accommodate those teachers who have not yet received a vaccine. And then the other part of that question is, do we know if the number of teachers who have received a vaccine or are in the queue is actually higher because they're getting it through any of the other sources, knowing that this is a decentralized system in the state of Maryland?
Well, that's an excellent question. I think the second part of your question is we're still trying to quantify that number. Potentially if some of our educators were vaccinated at one of the mass vac sites or at another entity, it's hard to track that. So it's possible that we could see a number of those folks haven't been covered there, so that number is actually higher. So to the first part of your question, we have actually, Dr. Stoddard and I, beginning last week, I've been looking at some alternative strategies to be able to increase access to the vaccine, not necessarily tied to the county apparatus, but looking at working with some of our other partners to be able to increase access. So in addition to the partnership that exists with Johns Hopkins and Suburban, also looking at some of our other clinical partners. Again, not ready to announce anything formally, but we have been having some discussions to talk about how we could potentially bridge the gap there and create some opportunities for those staff, particularly for the staff that would be going back first. From my understanding, earlier this week, that was probably about somewhere between 1,300 to 1,500 individuals who were yet to receive an invitation for March 1st, an additional 1,500 for the March 15th date. So we're working through that. And we have been looking at potentially how we could leverage some of the doses that we have as part of the county apparatus to be able to support that effort.
Well, I think that is very encouraging news because if we are prioritizing return to school, and we all are prioritizing this, we have to do everything we can to facilitate that. So while you're not making news right now, I appreciate that you're well on your way to helping figure this out and make sure our teachers are safe and feel safe when they do return. Thank you.
Well, thank you very much, Councilmember Glass and Dr. Gales. I actually got you out with 2 minutes to spare, sir.
I'm going to use those 2 minutes.
Sorry. I tried.
No, that's really quick.
Go ahead, please.
The final question for you, Dr. Gales, and thanks again for your leadership on so many levels. So we do have some lessons learned from the contact tracing of independent schools that have gone forward. And I believe, correct me if I'm wrong, but most of those positive test cases in the schools occurred from students or faculty or staff that were at a family gathering or a trip, and the spread had occurred or the incidents had occurred at that gathering. And so there hasn't been correct me if I'm wrong, but has there been a lot of evidence of spread within those schools themselves, or have those cases predominantly been folks who have contracted the virus elsewhere and then brought it into the school? Or have we been able to trace some cases from actual access within the school?
Well, there have been all of the above, but in a lot of instances, the index cases have been exposed outside of the school in some other place and have brought that within the school setting. And there have been, not a ton, but there have been evidence of in-school transmission, if you will, from whether it's teacher to student or student to teacher and so forth. There have been a couple of concerning activities associated with it. For example, a number of the non-public school cases, outbreaks, they were tied to youth sports activities. So, family gatherings, but then there were some travel teams. And so individuals participating in tournaments in other states and other places, contracting the virus and then bringing it back into the athletic setting or potentially into the school setting. And so, again, part of reopening also extends to those other activities as well. And you're correct. There is the potential, much like we would have in any business or any other situation, where activities outside of the school, which, you can put forward every type of mitigation strategy under the sun, but it doesn't control activities once individuals leave the walls of the school setting. And that's why it's important not only to emphasize the mechanisms that mitigate transmission within the school setting, but to also remind people that when they go home into their spaces, to continue to monitor, to adhere to the guidelines that we put forward, because that ultimately helps keep things safe. Again, community transmission, we keep that down and we keep that low. It decreases the risk that someone is going to encounter it outside and bring it into the school setting and set up potential for transmission.
Perfect. You nailed it. That was the soundbite I was looking for. Thanks.
Happy to help.
So thank you very much. And Dr. Gales, I'm going to say adieu to you, sir. We really appreciate, again, your teamwork in working with MCPS and your leadership as county health officer and getting us through a lot of the vaccination issues that we currently have before us. So thank you for that, sir.
No
All
problem.
right, so
We'll see you all tonight.
all right, colleagues, so we're going to go back to the list. I'm going to start off with just one question, colleagues, and then it will be Councilmember Jawando will retain his position, then Councilmember Navarro, then Councilmember Glass, then Councilmember Reamer, and then Co-Chair Albornoz, just so you know, in terms of where we are in terms of order. Dr. Smith or anyone on your team, what a lot of parents have asked is what their school day is going to look like. So if you can just help me to understand, walk me through what the typical day may be. Are there people checking folks' temperatures at the door and turning folks away? What's happening on the bus? Are they turning children away from getting on the bus? You know, how does all of this work? And then what happens in the classroom? Are students rotating? Are teachers rotating? Walk me through what it's going to look like and what our parents and children can expect to see in a typical school day when you return back to the classroom.
Well, obviously, it will look different at different levels, different grade levels and different subject areas. But there are some things that will be very standard. And first and foremost, the protocols we've been describing for safety and well-being will be very standard across the system. While students will not have their temperatures taken before they get on the bus or before they walk in the school building, we are supplying every family with a thermometer so that they can do the attestation. So, and the reason for that is the whole issue of temperatures has been a very much a mixed bag in school systems that have been open this year so far. And so I'm going to ask Derek Turner, so that I don't do all the talking during this meeting. I'm going to ask Derek Turner if he'll talk about the health aspects of it in just a second, and then Janet Wilson to talk about the instructional aspects and the learning aspects of it. But just overall, when you think about a school day, you're going to see students in classrooms, about 10 of them. You're going to see a lot of adults in and around the building. And you're going to see minimizing movement among and between classrooms by both students and adults wherever possible. You're going to see what you would have seen before COVID-19 if you walk down the halls of Quince Orchard or College Garden or Silver Spring International School. You would see kids working with adults, but they will be physically distanced. You will see students working on Chromebooks, just like you would have seen prior to COVID-19. You will see students working in small groups, both on screen and physically distanced in a room. Although with classes of 10 to 12, the small group might become the class more often in that discussion. But you will see lots of teachers, lots of paraeducators, administrators, teacher leaders. You will see the much discussed monitors that have been discussed in the community that we're hiring because, and this is a really important factor, what a lot of people don't understand is you'll no longer be able to raise your hand and say, may I go to the bathroom? Someone will actually have to escort you to the bathroom, an adult, for younger children especially, but to some degree, all students. We won't have free movement across the building because we have to guarantee the physical distancing, the mask wearing, those sorts of things. And so when we hire those monitors, they will be helping move students off the bus into the building, in the building into the classroom, to the restroom, to the lunchroom, to another location if necessary, to the health space, the health suite if necessary, back to the bus. And so we'll have all that movement. If we won't have open doors where people can walk in and sign in and just go in the school building because it will be a closed environment. So physically, it's going to look much more like the videos that we've produced, the College Garden simulation that many of you took part in, the NBC news and other news coverage this week at one of our middle schools. It's going to be a very different environment. And so, Mr. Turner, if you could talk more about those physical structures, and Dr. Wilson, if you could talk more about the integrated, blended kinds of learning activities that are going to go on all day long. Mr. Turner?
Sure. Thank you, Dr. Smith. So students are going to wake up in the morning, do their usual routine, brush their teeth, have their breakfast and get dressed. But before they walk out the door, we're asking that they take their temperature and make sure that they don't have a fever. We're going to also ask them to check the symptoms. Do they have a cough? Do they have a lack of taste? Have they been in close contact with someone who has COVID-19? If they can say no to all those, great. They're ready to go out the door, and they're going to go say they're taking the bus. They're going to go to their bus stop where it's going to be physically distanced. And so the bus is going to arrive, and they're going to get on the bus, and they're going to sit one per seat. But this cuts our bus capacity in half. We've talked about other strategies where it's one every other seat, but we realize it's not actually practical to be able to do that and transport our kids. But we are keeping the windows open on the bus so air flows through. Everyone's going to have a mask on. If you walk to the bus stop, forgot your mask, the bus has masks for you. The bus has hand sanitizer for you. So you're getting on the bus safely. The bus driver is going to have his mask on or her mask on, and you're going to roll to the school building. So you get to the school building, you get off the bus, and there might be a line outside to get into the building. So everyone's gonna distance 6 feet from one another as you get in the building. And as soon as you get in, there is a PPE station. Say your mask is looking a little soiled and the person at the station notices it, you're gonna get a new mask. You're gonna get some hand sanitizer. You're gonna walk through that vestibule, that front of that building, and there's gonna be a path for you laid out, which direction you're supposed to go. Some say one way this way, some say one way the other way. You're gonna follow that path to your designated classroom, and you're gonna sit down, and there's going to be everything you need in terms of technology in front of you. You're going to see your smart board that you're familiar with, but you're also gonna see the teacher's Chromebook and a document camera, and you might see your kids, your colleagues, on the smart board because they're in Zoom because it's a partly virtual class. You're going to pop open your Chromebook so you can engage with them as well potentially. And then you're going to start learning. And I'll turn it over to Dr. Wilson to talk about that experience.
Thank you, Mr. Turner. So I want to go back for a second about the virtual community as it is right now. And we had, an example was 26 students tied to a teacher at elementary school for the most part of their day, or in middle and high school, we have students that move about to different courses throughout their day. So I think the question was asked, will students be moving about? In our elementary schools, students will be pretty stationary other than they may relocate for art, music, or PE. And art, music, and PE, quite frankly, in some buildings could be still remaining virtual. But that's the case that Mr. Turner just told you. There may be students in the classroom that are ready for art, but then there are other students who will tune into that art class virtually because the teacher teaching the art may also be a virtual teacher. That's going to vary across buildings. For the most part, though, our elementary students will remain pretty stationary with different support staff coming into classrooms to offer a variety of instructional approaches, just as we did in brick and mortar. For instance, interventions, small group interventions. Now, virtual students have virtual breakout rooms, but in a classroom in elementary school, they'll actually be able to group with their peers, have small groups in person, while the students that are still virtual will do the same, but they'll be in virtual breakout rooms. We'll be doing reteaching of concepts, whether it's been a direct teaching experience in person or a virtual teaching experience the students have been provided. We will be reteaching those concepts, just as we did in brick and mortar. We'll have structured class discussions, peer-to-peer interactions. There'll be opportunities for students to attend recess. We have schools that are planning for lunch to be in the classroom. In some cases, students are relocating to the cafeteria for lunch in a very defined setup, small tables, everyone facing the same way because students have to remove their masks in order to be able to eat. Also, one of the big benefits of returning in person is that social emotional learning aspect. Being able to have that adult interaction, and so therefore they'll have counselors, they'll have access to PPWs, and so students will come in contact with a variety of staff members, resource teachers, regular classroom teachers, PPWs, counselors, administrators, our paraprofessionals, and as Dr. Smith indicated and Mr. Turner, the use of monitors, because when we bring students back into school, there's an additional obligation of that supervision from the time they step off the bus to the time they leave us at the end of the day. So that does take more human resources at the building level. And so we could very well have teachers who are in building who are still opening up their Chromebooks, logging on and teaching students who are still electing to stay virtual. So that's a little bit about the elementary. In the high school, because students are tied to courses, which are tied to credits, we will have students moving around a bit. But as Mr. Turner said, we've been very prescriptive about how students move in the hallways. We will be doing structured release of classes so that not everyone is in the hallway at the same time. And because we're staging students in, starting with grade 12, then backing up to grade 9, and then a 10 and 11 coming in, there'll be few kids to start, but by the time high school is finished, we'll have approximately 20,000 of our high school students back as we phase through all those stages. So we'll be practicing that movement about, staying as much as possible in cohorts while in classes, but kids, as you know, disperse and go to different classes. So it's really even difficult to keep students in the same class and have teachers rotate just by nature of the high school schedule. Middle school is very much like the high school, not a credit per se, unless it's just algebra, but very much they will also be moving somewhat throughout their day and also experiencing all of these different instructional approaches.
Well, thank you very much for that. I really appreciate it. I'm going to turn to Councilmember Juando, followed by Councilmember Navarro, followed by Councilmember Glass and Councilmember Reamer. Councilmember Juando.
Thank you, Mr. Rice, and I'm turning on my timer here so I make sure I'm appropriately staged here. Okay, and if MCPS folks could just be concise with the answers, I'll try to ask them in a way that facilitates that. Thank you. No, vaccines. Councilmember Glass brought it up. Will every teacher, if they're not vaccinated, do they have to report, or they have the option to teach virtually? How will you handle that?
We have not tied returning to vaccines, but we are working with Dr. Gales and Dr. Stoddard with Johns Hopkins and everyone else to make sure that we get as many people vaccines as want them and need them. And Dr. Nixon is working on a way to collect information without violating people's personal information. And so that will begin next week, right, Dr. Nixon? Is that accurate?
So we're hoping either Friday or Monday, yes.
So if you're uncomfortable, if you're a teacher or a staff member, you're uncomfortable in returning without a vaccination, you still are expected to return.
Well, it depends on the role that you play in the school. And we do want people in schools, but we do have schools where we will not be able to house all of the employees in that school. We often use the word teacher as kind of educational employees. Catch-all. And so we have to realize we have school buildings where we cannot put all the staff members back in that building with all the students. So and if you don't want the vaccine, we're not going to force you to take it or know that. You know?
Right. So, but if expressed, that would be taken into account along with the larger.
Yes, it already has been. We've been working through that now for many, many weeks.
Perfect. Thank you very much. And that's great news on the continuing, progress with JUHJ and others. A lot of people are asking two more questions. One related to the return schedule. And you started, Dr. Smith, saying some people want everyone back tomorrow. Some people don't want anyone back, but so it's an impossible situation. But explain why the staging, just if you could briefly, why you decided to stage and bring people back in the order that they are, as opposed to bringing everyone back by one day certain, for example. I know the answer to this, but I think it's important for the public.
Well, we want to start with our youngest children. As Dr. Wilson said, many of them have never been in a school building, or they were in a school building now a year ago for part of 1 year, or even part of a year before that, and then part of last year. We have to have time, and so to bring in our youngest children and those students in our special education program where our most vulnerable students are served. That's the place to start on the 15th of March. And then CTE, we can do that. And so we don't want to have what many school systems have had, which is open, close, open, close, open a school, close a school. We want continuity, we want stability, we want to move in and do it right. And as you saw in those phases that Dr. Wilson put up, no later than. We're open, and the board discussed on Tuesday the possibility of accelerating as we get into this and fully move into it.
And I appreciate that. And I'm fully supportive. I think we want to stay open once we're open and being able to correct as it goes along. You have a big school system. It makes sense, perfect sense to me. I understand the frustration of parents. The last thing on this round, and I'll be put back in the queue, is the airflow question, the ventilation. There's a ton of questions related to this. And my specific question is, I know you've had studies done. Has every school physically been tested for airflow? Yes, and that's kind of a yes or no question.
Mr. Adams.
So every school, I think that's a pretty loaded question. Tested. So some school districts.
Has someone physically been into the building to measure the airflow?
And every classroom has at least MERV 13 filtered air, as well as robust ventilation that is circulating through, which exceeds, I think, many, if not all, school districts anywhere in the vicinity or in the nation.
Okay. There have been some who have expressed, and I think, I understand why people are concerned. From a transparency perspective, they want to verify and see the data for the classrooms, particularly in some of the older school buildings. Are you all making that available to folks who have requested it? I would suggest that you do. I think I believe what you're telling me, but I think people and parents wanting to see it for themselves. Could you address that point?
Sure. So I know a lot of school districts have spent a lot of money on engineering reports. We have chosen to spend our money on the actual improvements, but certainly we are fully transparent. We think that's a very important part of this process. So absolutely, we want to be open book, and we will continue to look for ways to make sure parents, teachers, all staff members understand what work has been done and what to expect in each of the classrooms.
But just a finer point, because is there a report available where a parent can go to their school and see what the airflow, what the measurements were for their school, where their child's going to be?
So we have not published individual airflows, but we have published the remediation mitigation work that's expected at each school.
Okay. Well, I'll come back. I just would suggest that we consider that if we have the number. I understand it might be an expense, but been a large percentage of the questions have been related to that for the teachers, staff, and the parents. So thank you.
Thank you very much, Councilmember Duando. Councilmember Navarro.
Thank you very much, everyone. Again, my appreciation, I think it's been said a few times. I want to add to that appreciation for all the work that has gone into this. I always thought, closing everything was hard, but trying to reopen everything, it's obviously a lot more complicated. So I appreciate the efforts. The first thing I have, just for clarification, a lot of answers regarding the issues of vaccines and for the teachers, specifically that letter that we did see yesterday. Was that letter just to reiterate to the county executive the desire for that collaboration to find other venues? Because I was, when I read it, I thought, I'm sure this was not the first time that kind of conversation took place, right? So was that just to confirm, reiterate?
Yes, it was just to confirm and reiterate. Yes, and it was to support him in his ongoing efforts with the state.
Thank you. I appreciate that, because I know I got some questions about that. The other question I had in terms of the survey, the 64,000 that responded roughly to say that they want to come in classroom, and then the 95,000 that would like to remain virtual. Do you have any kind of demographic breakdown, whether racial, ethnic, or regarding socioeconomic status, farms, just to understand who are the students that will remain at home and who are the ones who are parents who are electing to come back in?
Yes, we can send that to you at the end of this meeting. And that is as of the December completion date, and then we're updating it now, but the real information we'll know is when they actually come back, because it's constantly changing each day as we contact families to reaffirm this is what you really want to do on March 15th, on March 26th. But we'll send you what we have so far, and then we'll update you when we update it, okay?
Great. Any trends that you have noticed at all that you can share?
More of our students, more of our students of color chose virtual, or more of our, this is a conclusion I'm drawing from looking at it, more of, because we don't ask this question, nor would we ever, but more of our families who are immigrants didn't respond. And so we reached out to them individually, and because of language and culture and those things. And so those would be the two trends that I think are most noticeable in it.
And so on that vein, and I really enjoyed hearing Dr. Wilson describe some of the supports, et cetera. I know there's that Wednesday sort of day for, I guess is to kind of retool, et cetera. But are there going to be any particular thought given to additional supports, both for the teachers, because I assume it's going to be quite the task to have students virtually while you also have students in the classroom. And then, of course, if you're already noticing those patterns of who's going to be virtual, how do we ensure that there's enough there to support our great teachers in imparting what no doubt will be a challenging task, and ensuring, of course, that also the students that are remaining virtual, that they don't, fall behind even further. Are there any efforts or thoughts about some possible models to provide additional supports and also engagement efforts for those families who haven't responded?
Yes, tremendous levels of work in that area. Dr. Wilson and Dr. Nixon, you've both been working in that area?
Yes. In answer to the question, Councilmember Navarro, about our outreach efforts, there's been, I'd like to touch upon that just a little bit and then get into the support that we're offering staff and what we're doing around staff, because it is a very labor-intensive endeavor of what we're doing. But I would like to say that since our survey closed, schools have done a yeoman's job reaching out to families. And the trend that we actually are finding is as they reach out, especially to the ones that we didn't hear from in the original survey, at each level, it's pretty well staying 50-50. They reach out to the family, they say, hey, we never heard from you in the survey. We defaulted you to virtual because we didn't feel as a school system we could put students into a physical setting during a pandemic because it was a health crisis. So we kept them on virtual. And as we reached out to them, at elementary level, 50% are remaining virtual. 50 are saying, oh, okay, I'll come in if I still have an opportunity to do that. And that's been the same at each level, elementary, middle, and high. And we are continuing those efforts. We are hearing from some families who do want to change their mind. And because of the CDC guidance, we have a wait list going. And so we certainly are time stamping that, but principals have the prerogative when they know there's a student that's waiting that has high need, they can move them, to the front of that wait list line because they know the students intimately and they have the data. Going back to the staff intensity, I'll let Dr. Nixon talk a little bit about our efforts to support schools in that regard, and then a little bit about how we're going to keep that support service going and some additional training for staff.
Thank you. So we continue to hire teachers every day. A few months back, we were able to allocate a 1.0 FTE to all of our schools to support staffing. Our principals had the opportunity to either hire a full-time teacher. Some of our principals elected to use their staffing allocation to make a part-time teacher a full-time teacher. In other iterations, the principal was able to convert it into a paraeducator position or increase hours somewhere along the road for a temporary part-time employee. So we continue to hire and interview staff every day. We are continuing to fortify our substitute pools. all of our substitute teachers who are coming through to support our distance learning in the very recent past. Through the onboarding process, we ensure that they have the same kind of compliance training and safety training, and an ability to kind of hone up their skills on what it means to distance learn. And many of our short-term substitute teachers have become long-term substitute teachers. We also continue to hire the monitors that Dr. Smith referenced earlier in the conversation, so that we know that we have the support that we need for supervision. A really great point of interest in terms of the monitors, we've had over 200 actually, former MCPS teachers are retirees who are coming out of retirement to help stand up some of these programs. And that's been really fabulous and great to see. We've had almost 800 interested applicants in the monitor pool. When we talk about the various phases of, applying for the position to actually being hired, we have about 200 in the queue. Of those 200, some are still in the background phase, background search. They need to pass that clearance before we can deploy them to schools, but we are interviewing every day. We are working with our retirees to kind of get that process expedited so they're in our schools. So grateful that our retirees stepped up. And as I said, our office and our staffing department continues to interview teachers every day and fortify our subpools. And we had great luck with our December grads too. So we were able to contract December grads. And what's interesting is we have this kind of mid-year hiring that's going on, and we're actually looking forward to the fall, knowing that the folks that we're hiring now will be great teachers for us in the fall as well. So it's given us a little bit of a jump start there. And what's great about that is not knowing what the future holds. Our teachers, our student teachers are very agile and can pivot at a moment's notice. So we're working through that in a variety of ways.
Thank you so much, everyone.
All right, thank you very much. Councilmember Glass.
Thank you, Mr. Chair. Thank you all. I had a series of questions and had done some crowdsourcing, and a lot of them have been asked, so that's very good. Two kind of different thematic questions I have. One is a practical one that people have asked about, and it's about Chromebooks. What is the policy going to be regarding Chromebooks, and especially the kids who are coming back into the classroom?
Mr. Turner.
I'm happy to answer that one. So every student has been issued a Chromebook and will be asked to bring it back and forth between the school and their home as it's connected to them. We're providing them cases so that they'll be able to carry it back and forth safely. So those will be at the school for them waiting when they come in. We'll ask that they bring it fully charged, although we'll have ways to run power. We don't want kids tripping over those cords because that's a safety issue. But if a kid fails to bring it in, we do have backups and spares. We don't want the entire class, the entire building to not bring theirs in, but we are prepared in case there are a few students who forget to bring theirs one day.
I think there are various scenarios which we need to be prepared for. I remember what it was like being a kid, although the concept of laptop had never entered my mind, right? Or for many of us here. So I can only imagine what will happen there. So thank you, Mr. Turner, for that. And the second question I have is a 100,000-foot level, really. MCPS clearly is not the only jurisdiction to take a prudent approach, right, to returning to school, to returning to the classroom. And as we look across the country, there are districts that went back in September, and there are districts that are where we are and are trying to reenter and figuring out those policies, waiting for more teachers and students, not students, but teachers to be vaccinated. And I'm curious, Dr. Smith, I'll address this to you. What lessons have we learned looking at other districts across the country re-entering, right? And some of those districts have had tough conversations with teachers as well. And I'm sure that there are lessons to be learned, best practices to build upon. And so how have we gotten to this point based on what we've seen across the country?
That is probably one of the most important things that's happened, Councilmember Glass, and since last April, we have been meeting regular with a consortium of about 20 school systems that are similarly situated 2 hours. The only other one in the state of Maryland is Baltimore County, but Fairfax, Wake, Palm Beach, Mesa, Arizona, Boulder, Colorado, Beaverton, Oregon, all across the country we have engaged with these. And in fact, I was on yesterday afternoon from 5 to 6 with those principals. Mr. Turner engages with them, Dr. Wilson engages with them, Dr. McKnight engages with them, and we engage with their content experts. In fact, yesterday we were talking about the whole issue of surveillance or pool testing and how we're going to get all our people together across this country to talk about that. So one of the things we've learned is that it's better to go slow so we can move fast once we get moving. And so we've all just been waiting to get this date of March 1st, and we got it on February 9th, and now we've gone very fast, but it was because we went slowly back before. Some of them have had the really miserable experience of opening and closing, and that's informed my thinking as we've worked with Dr. Gales, the people on this screen, because it's contrary to what some of our folks would say in the community. It has not been all roses and sunshine for those systems that opened in September. They've opened, they've closed, they've paused, they've opened again. And so we've learned about testing, we've learned about instruction, we've learned about technology models, we've learned about transportation, we've learned about how to serve meals in schools. There's no end to the value that has been since last April till up to and including yesterday and going forward to work together on that.
Well, I appreciate that. You know, I had not known the level of communication and collaboration that had been that you'd been undertaking and that other similar districts have, because when people share things with me and say, look what this district and that state are doing, it's hard to make those comparisons, but to find a cohort, a like-minded cohort like you have, where best practices can be shared and devised, I think is in the best interest of everybody. And you'll still be working out the kinks and still be evaluating. And my time is up. High five to you, Mr. Chair. Thank you. And thank you very much. I appreciate it.
We'll send you the list of school systems we have collaborated with, so you'll have that information at your fingertips.
That would be great. Thank you very much.
Thank you very much, Councilmember Glass. Councilmember Reamer.
Thank you so much. So glad we're having this conversation today. So glad we are now, the wheels are turning. I've got 2 kids at home, and one of them returns on April 6th and the other on April 26th, the day before my wedding anniversary. I think we're going to make it, but we're both teleworking. You know, issue I wanted to talk about, I wanted to mention, I think pandemic fatigue is affecting our students as well as our parents and families and teachers. I think everybody's hitting walls. I think our students are hitting walls too. And I think getting back into class is going to help really break that for them. I wanted to just talk a little bit about vaccinations. On Tuesday of this week, Dr. Gales, Dr. Stoddard presented to the County Council. We had I thought, a helpful conversation on MCPS vaccinations. It appears to me that we are, I don't know if Dr. Stoddard is still with us. If he is, I was going to ask for his participation here. We are nearing the point where we will have invited all of our 75 plus residents for an appointment. And at that point, we move to the next stage, which is, younger people and other workers. And I think at that point, the public will understand if reopening schools is one of the express priorities of the next phase, and that doses are allocated for our educators and school employees. And at the same time, the amount of doses that are going to be shipped are increasing, and the supply is going to be growing. And as we look down the road in the next 3 weeks or so, I think we're all hopeful that supply will increase. It won't be like a doubling or anything like that, but it will be a meaningful increase. And with your staged return, potentially even an accelerated staged return, I don't know, we could match dosing to those who are returning. understanding that it's not the school system's policy, nor is it the CDC's guidance that a vaccination is a requirement. However, it clearly, I think, eases the conversation and makes people feel much better about everything. And there is evidence now, growing evidence, that one dose is highly protective and that protection level increases steadily. And so the amount of time at which anyone, might be exposed without full protection is potentially quite minimal. But more to the point, it seems to me the county ought to be able to match dosing to the return strategy. I know that we only provided, or that we were able to provide. I don't say only, because this is the most precious resources we've ever had to allocate ever. We were able to provide, I think it was 4,500 doses. I don't remember the number, through the Hopkins partnership, and that was terrific. So I wanted to ask Dr. Stoddard if he could share again sort of an overview, and then we could just, I think it's really for follow-up, but I just want to suggest, I think that the county should be able to provide certainty that we are able to dose people as they return through this staged returning. And I think if we could do that, I think the public would understand, and I think it would ease tremendously a lot of the anxiety about this. So if I could just ask you, Dr. Stoddard, to share some of the information you had shared previously.
Yeah, so everything you've assessed is pretty correct. I think the one thing I would caveat with is that while the state, we have every reason to believe the state's going to begin to receive more doses and considerably more doses, we do not know how the state will choose to allocate those doses, meaning they very well could push more doses to the mass vaccination clinics across the state, and therefore we would not see a local increase either to the health department or to the hospitals. We just don't know that. We're hopeful that we will see an increase, and obviously if we do, then that makes things a lot easier. Now, I think generally though, your premise is correct that we will be moving, we hope to be moving beyond the 75 plus, or I should say beyond. We will be including more groups with the 75 plus in coming weeks. We will have been able to offer everyone in our pre-registration list over the age of 75 an opportunity to be vaccinated, certainly within the next 2 weeks. I think potentially even sooner. Now, we will still have people who are coming on board, particularly in our Black and Brown communities who have not pre-registered. We'll have those come on board. And so, it's sort of, as we've discussed before, when one phase is coming down, it's coming down slowly, and you're ramping up the other phase at the same time. Now, we obviously do agree that the educators are important. Obviously, we also think that the non-public schools are important too, as are the child care providers, and who are already operating in many cases. And so obviously we'll have to, and we're actually under obligation from the governor. We wouldn't need this obligation, but we're under obligation that whenever we expand into educators, we have to include both the non-public schools and the public schools in those vaccination efforts. Not something we disagree with, to be clear, and that's just factoring how many doses we would need to move into that tier. We have to think about it that way as well. I don't see any reason why the county won't be able to get vaccine offers out to MCPS and to non-public school teachers along the timelines of the current reopening schedule. But I get a little nervous promising it because we aren't promised doses from the state other than the 2,500 that we've been given for the next 3 weeks. And, with 20,000 more after this initial 9,000 on March 15th, MCPS employees, including, I believe, the substitute teachers and others, it's a fairly substantial number between now and mid-April, but we're committed to trying to make it happen.
Thank you very much. I think I know my time is up. Okay, well, thank you. I think we ought to keep working on this, and I really like to see the county try to solve this problem. To be supportive. Thanks.
Thank you, Councilmember Reamer, and I can always put you back in the queue. Co-Chair Albornoz.
Thanks. You may have listed this number earlier and I may have missed it, but how many students are on the waiting list right now?
That would vary by school. I'm
Yeah.
sorry, you're there, Janet. Go ahead, Janet. Sorry, Dr. Wilson.
Yes, when we released the plan in February, on February 9th, and now as our communications went out to families this week, families received a letter that really encompassed each school's plan. Schools are beginning to collect those waiting lists. I don't have the number, so it's a relatively recent phenomena, but we'll be pulling that in. I've heard anywhere from maybe 4 in a school up to maybe 20 with several different grade levels involved. It does vary per school.
Yeah, that number is going to increase rapidly once the schools reopen. That's what happened to the independent schools. Just be ready. And
Yes.
and just next is a comment, again, using my wife, and she's going to love that I've talked about her. Not at all. It is very difficult to teach both in the classroom and then the folks at home, because you've got technology issues on both sides. You have students with needs. It's just a challenging situation. And so it will be very important to clearly set expectations for both the students in the classroom and the students at home, so that if, those inevitable periods of time where there's like silence, the students will have something to do, and the parents as well, because it's already, as we all know, very difficult and anxiety ridden to be hovering over your kids while they're on a Zoom lesson. But then when they don't know what to do on top of it, the anxiousness and anxiety grows even further. So I know it sounded, Dr. Wilson, like you've got a great plan in place. I'm confident you do. And Dr. Nixon, you mentioned it. But just to underscore, setting those expectations on both sides will help everyone, both in the classroom and at home, which I think is going to be important. Last question for now in this round, and I thought Councilmember Reamer was going to go there with his initial comments, but I want to complete them. There is tremendous burnout. People are exhausted. They are overwhelmed, and we are very concerned about the social and emotional status of students. I suspect when students come in, a wave of challenges that we weren't aware of are going to be brought to bear. And I'm also frankly concerned about the social and emotional status of teachers, who are the anxiousness of having to go back to the classroom, those first few days of transition, which are always difficult, even in the best of times, are going to be overwhelming and exhausting. And frankly, all of you are probably overwhelmed and exhausted as well. I would just encourage you, to the degree to which you can, to build in some time for some mental health breaks, both for the students and the teachers themselves, particularly in those first couple of weeks of transition as we're getting adjusted, and just manage those expectations, because it will be tough. I mean, as the best laid plans, there's going to be forks in the road and some bumps, and just to make sure folks know that, I think will be really helpful. What supports are you providing on the social and emotional side?
We understand and agree, Councilmember Albornoz, and we've been doing all through this a lot of work around the social, psychological, and physical needs of students. And so the adult learning is geared toward that, to support teachers as they learn new ways to support students. Dr. Wilson, you want to share some of the work that Rochelle Rubin and team have been doing in parent academies, in presentation, in the well-being series, and all those things?
Yes, we have everything from mindful moments. We've done a series of videos for families, our staff, our students. We had a mental awareness conference about, I would say, time and space gets warped in this pandemic, but I think about 6 or 8 weeks ago, that was well attended by students and staff alike. Very much on our minds in terms of how to support our staff. We just provided a series of professional development to all teachers and all paraprofessionals. It was required professional development on February 12th. One of the main focus areas was the social emotional learning component in how to support students as they transition back in building, and quite frankly, also how to continue the support for the students who are remaining online, some of which we know would like to come in, but their parents have reservations for whatever reason. So it's also keeping that aspect in mind as we support the students in both of those environments.
Final question. Obviously this has wreaked havoc on the school calendar and will next year probably as well. Has there been any consideration or thoughts? We've gotten questions about the possibility of extending the school year or adjusting the following year's calendar.
The following year's calendar is right now being looked at and developed, and that will come before the board policy committee and then the board in the next 8 weeks. The extending the school year, no, because we have 161,000 or so students still in the system, and they have very different circumstances, and so that puts people at a disadvantage. But what we have built is a massive summer program to the tune of more than $20 million worth of costs, actually more than $25 million worth of costs for the summer program. Elimination of fees by and large, so we're not charging people, and a mixture of enrichment, acceleration, support, activity-based classes and makerspace classes, as well as credit-bearing classes for high school students, either to do something they didn't get done this year or to do more in preparation for next year. So last year we had 80,000 slots across the system for summer school. And, some students took advantage of 1, some 2, some 3. This year, we're going to significantly increase that number of activities for that summer program.
Thank you. Just in closing, we've got your back. We appreciate you guys. We're going to do everything we can do to help. Just let us know what you need. Thank you.
Thank you very much, Mr. Co-Chair. Councilmember Duando.
Thank you. I was going to ask, and I still will, because I want to follow up about the extended year. I know several of you were with me when I visited Arcola, and which is one of the piloting extended year schools. I think we're right around the time with everything that's happened, but I know it's kind of thrown off. I think we were expecting some data about how the students did that were in that program. I'm a huge proponent of extended day in normal times. I think it's almost absolutely extended day, extended year is absolutely necessary to look at as a long-term strategy at this point. I appreciate the massive summer program, but so talk a little bit about, will every student that needs it, are we going to target to those who have furthest behind and have aggressive outreach to those students who are struggling to get them in these summer programs, and just talk about how you're factoring that in?
Both. We'll both target and invite and provide access. So students who need the support, and there's evidence in our data or in anecdotal evidence, then we will pursue those students. Students and families who want it, we'll open it up and provide access. So we want to have that two-pronged strategy going this summer, so that no child falls through the cracks or is lost, so that we either aggressively pursue the children and we aggressively provide access to all families who want it, no matter where they are. And we started that last summer. We're going to continue to build that out this summer. And I agree with you. I think a year from right now, MCPS or even earlier in next year ought to be looking at extended year as it can move forward with pilots around community schools. So you have community schools that have extended year, and the board has set aside and is sending to you a budget with literally millions of operating dollars to do some pilots around community schools. And then if you add the extended year that we're doing at Arcola and Mix, you could really have a way of working with all schools, but in particular to begin with the highest poverty schools right now in doing that.
Yeah, I appreciate that. And I look forward to that. I think it's a critical part of recovering equitably here. I mean, it's just hard to believe as we look at these dates. It's a calendar year. I have a kindergartner who went to kindergarten, stayed till March, and hasn't been back, and has been out of school more than she's been in. Along with our other kids. And it's just, there's so many children and families that are dealing with that at critical stages, and we're going to be dealing with this for a generation. So I really appreciate you saying that. the Councilmember Navarro brought this up earlier about the equity and who returns and who doesn't. This is tied into that. I think we're just gonna have to, I'm glad you're gonna send that data over. We're gonna have to be monitoring that very, very closely. As we know, as you mentioned, it's disproportionately one of the many, many sad things about this pandemic is that where the spread is lowest and the schools, the children are most likely to come back is where you have the wealthiest, most affluent, and best able to deal with the consequences of an outbreak and the like. And so it's just very inequitable. So we just have to, I know you all are monitoring that and I appreciate it, and let us know what you need. I know there's also efforts, and I'll be working on this more as well with my colleagues around all the support students are going to need. Students and educators are going to need social, emotional, mental health, the wraparound services. You mentioned, some of the summer programs, but obviously after school included. Don't be shy. If we can't do it now, when are we going to do it? Because, and hopefully a ton of money is coming to you, I hope, out of the $1.9 trillion CARES Act. So I guess if you can comment now in any way, just about how you're looking at those whole suite of services, both when kids come back and going into the future. You mentioned a couple to make sure that we're getting our students what they need to re-enter.
Yeah, we have been developing what we call a 2.5-year plan. This 6 months until June, that's the half year. That's our chance to get ready for the next 2 years. But if you consider that our current second graders or your current first grader, your daughter, right, a first grader, yeah, she will walk into the 4th grade after 2 more years of school. That's when we ought to be able to look at how students are learning and really understand the degree to which we've addressed and eliminated the disruption that has occurred in their schooling. We can know a lot as we go forward, but and there are 4 areas: highest poverty schools, literally millions of dollars of operating budget, and these grants. We already have one. We're hoping that this other 1.9 trillion comes through the way it's moving right now. We'll see. We don't know anything yet, but we'll know more. But highest poverty schools, millions of dollars. The disruption of learning across all schools, because we know every child's been affected, some more than others, some in affluent schools, some in middle class schools, but all schools have got to have tutoring. They've got to have Saturday opportunities. They've got to have in-building, in-day school opportunities. So all school disruption is the second area. Physical, social, and psychological well-being, adding of staff, adding of services, adding of programs for next year. And then finally, the digital realm and innovation that Mr. Turner is responsible for, and that's standing up a more permanent digital academy for those students who will remain on it for health or other reasons, but also using the digital world to expand and create opportunities for, we talked about bringing CREA and METS. They serve our oldest ESOL students in the system in that second phase, but we can serve them better if we can do more in the evening, if we can do more flexible time, if we can create opportunities for high schools to offer courses across the county digitally. So those are the 4 areas that we're working on, and literally tens and tens of millions of dollars are going to go into each of those areas as we plan for the next 2 years, because it needs to be aligned, and then we need to follow it. And if it's not working, or we find a gap or an overlap where we need to do things twice, then we need to fix it all the way along. So we monitor, adjust, and we'll know the success of it 2 years from now when your daughter walks into 4th grader as a first grader who lived through the pandemic.
Yeah, thank you. And I know my time's up, but that is very helpful, I think, for folks watching and for me. So thank you, Dr. Smith.
So Dr. Smith, I know that we have a hard stop at 5 o'clock. I'm going to jump in and just ask you a couple little rapid fire questions, and maybe even Dr. Stoddard may be able to help with this first one. The deaf community had acquired and really been a push for the clear masks to be able to see facial expressions, those kinds of things that were incredibly important. And I think that for our children that are still going to be learning at home, to be able to see expressions of their teachers and kind of follow along that, because right now they're looking at teachers without a mask on, so they won't have that benefit any longer. Have we looked at and explored being able to obtain those for those teachers who will be operating in that hybrid model?
Mr. Turner, talk
Yes,
about
yes.
what we've done for special PPE, please.
The answer is yes. We have purchased clear masks for, especially for the deaf and hard of hearing community. So it's easy to see their expressions and, more importantly, read lips, which is critical to that group and that community.
Excellent. And so those will also be offered to other teachers as well, as they really want to hone in on, I think about my daughter who's in a chorus class. She'll still be virtual, and so need to see the shape of the mouth, all those kinds of things. Is there, doing kinds of things like that? Will those masks be available to everyone who wants them, or are they just for special education?
We're going to prioritize those who need them for the special education program, but we're going to keep ordering PPE. We have literally hundreds of thousands of face coverings and shields in different styles, and so we're going to keep ordering based on the need of the school.
Fantastic. And I would just ask Dr. Stoddard, if you could please help to assist the school system if they do need it, to be able to make sure that those are there. Councilmember Juando talked about this and touching on the COVID slide, if you will. And I know that we in Annapolis have been looking at this from a state perspective at MACO, and asking the state to really leverage some financial dollars to help our 24 jurisdictions in being able to address what we know are benchmarks that sometimes are going to get lost in both third grade, as well as those in kindergarten, those in fifth grade, as well as those entering to high school, and then of course our special education, as well as English as second language students. When can we expect to see some sort of more robust kind of plan as to what we intend to do this summer to address some of those needs regarding the COVID slide?
We'd be happy to come back and share our summer plan with you. And at that time, we could also share some really important work that Dr. Wilson's doing right now with a whole team of people around our equity accountability model and our evidence of learning, because that's been turned upside down too because of the data. But there are other ways to look at the data and other kinds of data that we can bring to bear on this.
That'll be perfect. So I'll ask Ms. Rodriguez-Hernandez as well as Mr. Howard if we could get something scheduled for that. I think that would be terrific, so that we can engage with the system in terms of understanding that. And as Councilmember Juando said, make sure that we're providing the support necessary. Of course, obviously, we'll need to do and leverage state funding, but also whatever we need to do locally to help ensure that our children have that continuity of learning and really address some of the losses that they may have is tantamount. I am going to close here and turn it over to my co-chair, but just wanted to say thank you first to my colleagues for being so judicious in terms of your time and adhering to the 5-minute rule. I think it worked incredibly well and gave us all an opportunity to ask a lot of questions from a various number of different angles. I really want to thank you, Dr. Smith, and your entire team for continuing to really think about this and outside of the box. It is not easy. It is going to be a tremendous challenge, and we're still going to learn a lot once those school doors first open. And we will need to make adjustments. There is no question. And we look forward to working with you to continue to support you in ensuring that we have both a productive as well as safe learning environment for our students, staff, teachers, everyone who's in our school buildings. I'll just close with this in saying that I do echo the same sentiments of my colleagues. I really do think that it is important for us to ensure that everyone who does want a vaccine be able to get that. I know that our health department will be working with you, as well as hopefully working with the state, who continues to lag behind, unfortunately, in terms of ensuring that these vaccinations can get into the arms of our teachers so that they can get into the classroom safely and teach our kids. And so with that, let me turn to my co-chair, Councilmember Albornoz.
This is another critically important milestone in the transition back to whatever normal will be for the foreseeable future. And I am so impressed with the thought and the strategy and the work that's gone into March 1st. I deeply express my appreciation on behalf of all of my colleagues and our residents and community. We know how important this is. There is no more precious commodity. There is no more precious treasure than our children. And so I'm confident that we're going to get through this, and whatever you need, Dr. Smith, please, as you know, don't ever hesitate to ask. And the final plug is for all of our county residents. It's on all of us to make sure that we keep our kids in school. That means adhering to the guidelines. That means continuing to wear your mask. That means staying home if you feel sick. That means supporting all of us. Each one of us has a responsibility here, and it's something we all have to take very seriously. Thank you again, Mr. Chairman. Great job, and look forward to hearing the report after March 1st.
Here, here. And Dr. Smith, I got you out 1 minute late, so I apologize. I owe you a drink. You guys take care. Thank you very much, and we look forward to coming back and discussing how the reopening plan is going, as well as what we're going to be doing for summer education as well. So